3.
I understand that the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering physical assessment to be filmed and posted on Blackboard for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Good morning, Samantha.
Morning.
My name is Nancy. I work with Dr. Smith. What brings you into the office today?
Feeling a little short of breath.
Can you tell me a little bit about your health history?
I've had cystic fibrosis since I was 2.
And so, tell me, how have you been managing your cystic fibrosis? What is your normal routine?
I wear my vest. I wear it twice a day.
Twice a day for the postural drainage?
Mm-hmm.
Okay.
I do deep breathing and coughing.
Have you been coughing anything up?
Yeah.
A lot?
Pretty regularly.
Yeah. And is it clear or is it yellow tinged or blood tinged?
It's kind of yellow tinge.
Yellow tinged, okay.
And I use my albuterol too.
Okay. How often are you using your albuterol?
Twice a day.
Twice a day?
Mm-hmm.
Okay. Have you been running a fever that you know of? Have you taken your temperature?
I'm not sure.
You're not sure? Okay, I'm going to check your temperature real quick.
Okay.
Your temperature looks like it's about 101. Okay, so you do have a little bit of a temperature. Have you had a recent infection lately? A lung infection?
Yes.
Okay, and were you on antibiotics?
Yes.
Okay, do you remember what kind of antibiotics you were on?
The Z-Pack.
Okay, and you finished those, how long ago?
Well, I didn't exactly finish them.
You didn't finish them? No? Okay, all right. Is there a reason that you stopped taking them?
I didn't think they were working.
Okay, were you starting to feel better and so you stopped taking them? Is that why?
No, I just didn't think they were doing much.
Okay.
So I just stopped taking them.
All
Didn't
right.
think they were helping me.
Okay. Tell me a little bit about yourself. What types of things are you doing right now in your life?
I'm in college.
Okay.
I'm very active in my church. Do a lot of volunteer work.
Okay, and what is the name of your church?
St. Christopher's.
St. Christopher's, okay. So is your schedule, are you going to school and working too?
Mm-hmm.
Okay, where do you work?
Oh boy.
Okay, so you have a very busy schedule. Do you feel like you've been taking care of yourself and managing your cystic fibrosis?
Probably not as much as I should.
And how has your belly been?
A little achy. A little constipated.
Okay. Are you having any pain right now?
In my stomach a little, and my chest a little.
Okay. And can you tell me a little bit about what this pain feels like?
Just kind of like
A heaviness in your chest? Okay. On a scale of 0 to 10, what would you rate your pain level right now in your chest?
probably 5.
Okay. Is it relieved by anything? Is the pain relieved by anything?
Sometimes if I cough up a lot of mucus,
Okay.
or when I wear my vest.
Okay. Now tell me a little bit about the discomfort that you're having in your abdomen. Does it feel like it's a cramping kind of pain?
Yeah.
Or sharp pain?
Like a cramping.
Okay. All right. Have you been taking your pancreas with every meal?
Usually.
Usually. Okay. listen to your lungs and check out your abdomen. Have you ever had to be on oxygen?
No.
No, okay. Can you
Never
tell-
wanted to wear it.
Okay. Can you tell me, how old were you when you were diagnosed with cystic fibrosis?
I was just a baby. I was 2.
Okay, you were 2 years old. And who do you live with?
My mom.
Your mom? All right, well, let me take a listen to your lungs, and then we'll talk a little bit about what we're planning on. When was the last time you had to be hospitalized with your cystic fibrosis?
Not for a while.
Not for a
Not
while?
for a while.
Like, within the last year, have you had to be hospitalized?
No.
No? So more than a year ago, 2 years ago?
Maybe the last 2 years before I started college.
Okay. And, so you're not like smoking cigarettes or anything else right now, are you?
No.
No, you don't smoke? No, okay. What is your normal activity level?
I can do a lot, but I need to sit down and rest. If I feel my congestion, I just need to try to cough some stuff up. It just feels all like mucusy, It's just, I don't go like running or anything. Just light exercise.
Okay. Do you feel like you've been able to do your regular activities in your life without feeling compromised by your lung disease?
Yeah, I've just learned to live with it. I know what I can and can't do.
Okay. Well, let me take a listen to your lungs. And if you can just take some deep breaths in and out for me. Would like to examine your stomach. If you can just lay down here for a minute so I can just check out your stomach. And let me know if you have any pain when I'm pressing.
It kind of hurts a little. It's a
Okay.
little tender.
Here. When was the last time you had a bowel movement?
3 days ago.
3 days ago. So you feel uncomfortable because of that, do you think?
A little bit. Want you?
Yes, I probably would. I'm just going to listen for a minute. Okay, well, there's not much activity going on in there. Let me just take a look at your nails. You look a little pale. I'm just going to check your pulses here. Over here. Okay, I'm just going to check the pulses in your feet. So I think what I'm going to do is I'm going to have the doctor come in also and examine you. There's a possibility that we may want to admit you into the hospital for a couple days. I would like to be able to get a sputum culture from you. When you feel like you can cough something up, you can give me a sample in here. I'm going to call one of the respiratory therapists and have them come in and give you a breathing treatment. I think we're also going to draw some blood gases. Are you familiar with that?
No.
You know, that's a bit uncomfortable because they actually have to stick in a needle over here by one of your arteries. But we
Is it
need.
gonna hurt?
It does hurt a bit, I'm not gonna lie, it does hurt a bit.
All
But it
right.
gives us good information about your respiratory status and also will indicate to us whether or not we need to put you into the hospital, okay?
Okay.
Would you like to call your mom and let her know? Okay. All right, well, it was a pleasure to meet you. I'm gonna have the doctor come in and see you. And then I will also come back in and we'll talk about the plan of care.
Thank you.
All right.